Dementia is a large challenge across the world. 55 million people are living with disease now, and by 2050 we think it'll be closer to 139 million. If you look at the determinants of a healthy brain, they're driven by the social determinants of health. And what I mean by that are the factors that affect physical illness also affect the development of the brain.
The most important thing in the diagnosis of dementia is the history. And the history is kind of culturally insensitive in the sense that you can, the history is often very clear, whatever background the person comes from. And I think we rely a lot on the history, and indeed in very severe dementia, it's often very difficult to have to use any of the scales that we often use.
At the moment, with 20% of our population of 1.3 million people, which is 260,000 are over 60, and we are aiming to 2050 to have 1 in 3, 30% of over 60. So we know that from the past 30 years working on, aging policies and aging. But unfortunately, up to now, lately, there hasn't been a dementia plan or integrated dementia care management and prevention.
Most of the people in our country, they think that loss of memory and behavioral change and loss of functionality is part of normal aging. So they don't even come to the doctor. So if you are like 70 years old, you are losing some memory, so they don't come. Unless you go out and see them in the community, you are not going to get those patients because they don't think that's a disease. They think it's a normal aging process. So you have to change the common perception among public by public awareness that this is a disease which is treatable and which can be kind of managed.
In your opinion, can you share your thoughts on how cultural norms and beliefs can impact the diagnosis and treatment of mental health? And do you think the DSM-5 is culturally sensitive?
Kenya's population is probably as diverse as most of the rest of the world's population. Now, the assumption is that because of the diversity, then if you make a universal diagnostic paradigm like ICD or DSM, that then it will not be applicable to these people because they are extremely diverse. That is the first assumption. But then, on the other hand, that presents a challenge to you from a diagnostic perspective because you must have a diagnostic framework in order for you to be able to frame a person's illness and then formulate a treatment. In working in Africa, you then understand the value of listening to the individual and learning their experiences and using that to then formulate a diagnosis.
When people are suffering, how do they express, what they are feeling? And how it varies across culture is because people are able to link this idiom of distress to somatic pain. Some people will say, when I feel this way, maybe I feel the headache, I feel my shoulders are heavy. A lot of work has been reported around this issue, but the problem is carrying the whole concept and putting it, for example, to DSM-5, it might not really apply to every culture.
How can policy and advocacy efforts be tailored to different cultural contexts when it comes to designing policy for mental health?
The appointment to an office such as presidential advisor is itself cultural. He will pick you because we know each other. And that influences a great deal the way you and the appointing authority formulate policy.
Do you think the medical curriculum today effectively covers cultural sensitivity?
I think, unfortunately, the majority of the teachers at the moment in our medical schools come from an era of ivory towers learning medicine, and largely learning medicine that is probably very good for tertiary academic hospitals, but not very good for the people in the communities out on the ground.
We do have the science, we do have the knowledge of how we can transform mental health globally, both through reimagining how we organize mental health care systems from the bottom up with our focus on the community and not top down. And secondly, through how we can prevent mental health problems by targeting the social determinants of poor mental health, especially in the early years of life, because most mental health problems begin before the age of 24, and this is not an accident, it is because of the very developmental nature of most mental health problems.